Welcome to everybody who's joining right now. We're just going to give it a minute for people to trickle in. We had a lot of people register for this. Oncofertility isn't exactly something that rolls off the tongue for a lot of people. It feels like it's a very niche thing. It's not, as we're going to talk about, but it's cool to see so many people joining.
Absolutely. Thanks so much, everyone, for being here today.
And Dr. Speckart, thank you for stepping in at the last minute moment, literally off a plane, I understand it, or something like that.
You're more than welcome. Happy to be here.
Yeah, I still see some people trickling in. I'm going to wait for it to level off. But that might never happen. We've done webinars before where people just keep joining the whole time. So, oh, we're still going. At Maven, when a meeting starts at a particular time, it really starts 5 minutes later. So, okay, I think we're good to start. Well, welcome again to everybody who's joining. Thank you for being part of this webinar on a Monday afternoon. Um, we're here to talk about oncofertility. And it may seem niche, but it's incredibly important. Um, it turns out that cancer, as we probably read about in headlines every day, is growing in prevalence. The incidence among young people, ages 15 to 39, I think is what's defined as a young person, so I'm not a young person. But the incidence among young people has been going up year over year, as I understand it, for decades. That's the bad news. The good news is that survivorship 5 year survivorship is pretty good among younger people. I think it's something like 85%. Dr. Speckart can correct me in a moment. But what that means is we have more cancer survivors than ever. And our industry is still very much catching up to that. In fact, Dr. Speckart and I were talking before we started, and cancer survivorship, even as a concept or even as a pillar among our professional societies, is relatively new. Programs for cancer survivors are relatively nascent. And so as my colleague Lisa March was telling me earlier, people's needs don't stop after their cancer has been addressed, and all people also have goals in life other than simply surviving. And family building is a really big part of that. So that's what we're here to talk about today. I want to briefly introduce my colleagues. So we can go to the next slide so you can see what their official headshots look like alongside their actual faces. But Dr. Speckart, do you want to go first in introducing yourself?
Sure, I'd be happy to. Again, my name's Ashley Speckhart. I am the lead physician for the survivorship program at Color. I am board certified in oncology and preventive medicine, and I focus on long-term health after a cancer diagnosis, which is typically referred to as survivorship. I have been working in this relatively new field for over 20 years.
Which makes you an OG, as we were talking about.
It might.
Um, and then my colleague Lisa. Lisa, can you introduce yourself?
Absolutely. Hi, everyone. My name is Lisa March. I serve as Maven's VP of Employer Growth. I've been here about 5 years now. You'll hear a lot about my story today, but this topic is deeply personal to me as an oncofertility patient and cancer survivor myself. And excited to share more and most importantly, share more about our data and discussion.
Great. Yes, that's a good preview, Lisa, too, is we're going to share about the topic, but we're going to ground everything that we're saying in some recent data, which is actually a little bit nuanced, which is that there's a general awareness of oncofertility, so that's a win. In the industry, people know that cancer and fertility needs intersect. Maybe I'll explain this explicitly because it may not be clear to everybody, but when you treat cancer, you go after rapidly dividing cells. That's why people lose their hair when they get chemotherapy. It turns out reproductive organs also have rapidly dividing cells. And so many cancer treatments render um, cancer survivors and fertile. And there's a very short window. Obviously, time is of the essence when you're treating cancer. Time is of the essence when you're treating fertility as well. And I imagine that many of the people joining today are joining because they know that cancer is a big need among your employees. It's an area of really high cost. And also, fertility benefits have become increasingly table stakes, and the two run together. So, June is National Cancer Survivor Month, which makes this a timely discussion. Um, but we actually fielded a study. And so we're going to spend some of our time talking about some of the nuanced findings in that study about how prepared the industry is for this and what we think they can do. We're going to learn from Dr. Speckhard and Lisa, and then we'll have some time to do a Q&A and answer some questions. Um, and maybe the one thing I'll emphasize here is that once someone has a cancer diagnosis, once a young person has a cancer diagnosis, you basically have 30 days, but I think in my actual clinical experience, usually much less, to do what you need to do to make very consequential decisions that can impact their future family building. Let's go to the next slide. And Lisa, I'll turn over to you to start sharing some of your story.
Sure. I will start by sharing that my story has a really positive, I'll say middle, it's never an end, but middle for right now. And so, why I'm here today, in part of being a deep believer in one size fits one benefits and reproductive health and cancer, is because I was diagnosed with early stage breast cancer in June 2020. So, canonically, a very easy time in all of our lives, early stage pandemic, lockdowns, everything was a question mark. And for us in particular, I was at home with my husband. I felt a lump and I knew something wasn't right. And I'm not sure if anyone else experienced trying to get a doctor's appointment or setting up care at that time, but it was really hard to get in person, and rightfully so, because hospitals were trying to be super focused on who they let in person, masking up, keeping any type of disease spread to a minimum. And so navigating what I knew was off with my body in a time where proactive appointments weren't easy to come by was a first initial challenge. And so after pushing and self-advocating for over a month to continue getting scans and tests, I was, as I shared, diagnosed after a biopsy with early stage breast cancer. This was really scary, I'm not gonna lie, very anxiety producing, and candidly, not the phone call a lot of our family members were expecting to get from us after being married for a year, and that our hopes and dreams of hoping to be able to have a family in the future were not only put on hold, but very much a question mark if they were going to be possible or something that we could even discuss. I share this with you because now that it's been 6 years, it still is something that's part of my everyday life. I love a spreadsheet. Don't get me wrong, Neil knows this, but being on point to manage every single appointment and portal, and this would become over 100 appointments in the next year with doctors to manage my treatment plan. What are next steps? How do I preserve my fertility and how do we do it quickly? Was really overwhelming. And we didn't have navigation that we would have today to help me and my husband go through all of this in what was a just big unknown time. And why I'm so glad to continue talking about survivorship today as well is that yes, I was the patient. I was going through everything physically with treatment and emotionally, but my husband was also going through this as my primary caregiver when we weren't allowed to see anyone else in person. And so his experience also going through fertility with me at the same time was really interesting because we didn't look like the brochures of cancer patients at the time. We didn't look like fertility patients at the time. And so we felt really alone in navigating all of this in a very, we'll say, unique timestamp that we've all been through together. Um, as I shared, my story does have a happy ending. We have an 8-month-old now who is learning how to sleep, which is a different type of we'll say, treatment that we're going through now. But all of this was possible because of the care that I received, and that we were so bullish on taking the horns really on our own treatment and figuring out what we needed to do for the best possible outcomes for ourselves.
Thank you for sharing that, Lisa. It takes a lot to vulnerably share something so personal, so really appreciate you sharing your story. And we'll thread more of that story into the conversation that we're going to have. Um, but maybe before we even get to the data, just to give context to both your story and some of the data in the study that we ran, I want to introduce both Color and Maven so that you understand where we're coming from. Ashley, do you mind talking about Color a little bit?
Yeah, absolutely. So, Color has built a national virtual cancer clinic, and it is designed to meet members' needs at every phase of the cancer journey, from prevention and early detection all the way through active treatment, long-term health, survivorship, and return to work. So, this model does not hand off patients at diagnosis or discharge them when treatment ends. We follow individuals continuously throughout the full continuum of care. So, for example, in early detection, we drive workforce-wide participation in prevention and screening. We provide easy access to at-home options. We proactively identify high-risk individuals and manage their guideline concordant screenings. We follow up every abnormal results. For individuals with a new diagnosis of cancer, we assure that those individuals are receiving a correct and timely workup and help the employee navigate the healthcare system. During active treatment, our oncologist-led team provides expert medical opinion to confirm the right diagnosis and right treatment plan. We deliver 24/7 symptom management and coordinate both nutrition as well as mental and emotional health support to make sure that employee's care is on track and avoid any unnecessary emergency room visits. And then when treatment it ends, the care does not end. Our survivorship team manages recurrence risk. We address long-term side effects. We monitor for long-term late effects. We support return to work with tailored plans and guidance for employees and managers. Color is also the first virtual cancer clinic to receive certification from the American Society of Clinical Oncology, which is typically referred to as ASCO. ASCO is the world's leading professional organization for oncology. ASCO certification is a rigorous certification process, and the fact that we are ASCO certified means that our virtual cancer clinic has the same quality standards as top NCI designated cancer centers around the world.
It's amazing. Thank you, Ashley. And what color is to cancer, Maven is to women's health. So we're the largest virtual clinic for women's health. We also operate nationally and actually globally in 175 countries. I think we have over 27 million lives under management now, so Maven is quite scaled. Um, we are not a condition-based company. We're a phase of life company. And so we take care of people from when they're pre-contemplative about starting a family all the way through a fertility journey, pregnancy, parenting, trying to get an 8-month-old to sleep, all the way to menopause. Um, we do have deep expertise in fertility preservation or conditions that impact fertility and pregnancy, preeclampsia, whatever it might be. But we take a lot of pride in actually also having expertise in the context of people's lives when they're going through these really complicated journeys. And so that's why we're so excited to be partnered with Color. It's Oncofertility obviously is a space that brings both types of capability and both types of expertise together towards very similar aims, which is helping employers and other purchasers take good care of their members or their employees, get to better care at lower cost, and help people show up at work as their best selves. Um, okay, so let's turn to the data that I keep on like alluding to. So at Maven, we have a clinical research institute that we've stood up, and we field lots of studies like this. We did this one collaboratively with Color, and we talked to 253 HR and benefits leaders around the country, all at organizations that have 1,000 or more employees. In some cases, many more, tens of thousands of employees. And we talked to a mix of leaders at different levels of organization. So at the director level, all the way through senior leadership and the C-suite. Um, and I think to get into some of the specifics, I'm actually going to turn it back to you, Ashley and Lisa, to walk us through this a little bit.
Sure. So I can tell you that cancer care is evolving faster than employers are prepared for, and that's just a new reality. Historically, cancer was viewed by employers as a later life health issue, but that assumption is no longer reflects what is happening in the workforce. Many cancers are increasing among individuals under 40 years, 50 years of age. So 85% of survey benefits leaders reported seeing an increase in cancer diagnosis among employees under age 50 during the last 3 years. And among these employers, um, so sorry, 2/3 of those diagnoses involve fertility preservation or family building considerations. So many employers, for many employees, fertility decisions are no longer separate from cancer treatment. They are happening at the same time, often immediately after diagnosis during a time of intense emotional and clinical pressure. That pressure creates a very different healthcare experience than most employer benefit systems were designed to support. Regardless of an employee's male, female, partner, or single, an employee with a cancer diagnosis may suddenly need to understand if treatment could affect fertility, evaluate fertility options, coordinate appointments across multiple providers, understand coverage options, and make decisions quickly enough to avoid delaying treatments. All of this while processing a life changing diagnosis. Yet many employers still underestimate how fertility considerations can influence cancer treatment options. Nearly half of benefit leaders surveyed were unaware that 1 in 5 young cancer patients modify their treatment plan based on receiving fertility counseling. So honestly, Lisa, I would love to learn from your experience. How was fertility brought up? Did you have to ask about that? Did your oncologist bring this up? When did they bring this up? Or did you you mentioned you had to be kind of bullish about this. Did you have to coordinate your care? Um,
Yeah, happy to share. So I was lucky that my oncologist brought this up in our first appointment together. That being said, like Dr. Speckert, everything you just said is spot on about the volume of questions and open-ended topics and things that are quite heavy that a patient needs to decide upon with immediacy. And so, what a treatment plan looks like, how are you adjusting your life and your schedule to be in person, to go through surgery or radiation or chemo or whatever it might be that an individual needs to go through for that treatment. And if anyone listening today is familiar with fertility treatments, it's also a big time investment. You need to be at your reproductive endocrinologist's office multiple times a week and navigate injections. On a good day, any type of IVF or assisted reproductive technology is stressful. On a good day, cancer is stressful. And so marrying those two together in almost a pressure cooker environment was a lot to take on at the same time. And to be able to sit, digest that information without a lot of that medical terminology or jargon familiar to my husband and I, and try and navigate that all in real time was really challenging. So again, I am one of the lucky ones who had a care team that shared that this was an important consideration very early and that we were actually able to model my treatment plan with oncofertility in mind versus it being an afterthought. The other piece you mentioned is this, how does this coordination happen? At the time, it didn't. And so my cancer team, my fertility team were aware of each other. They gave a warm lead that was so helpful and beyond what a lot of patients do receive, but it still required me to do the coordination and to make sure, okay, we've reached X milestone. Now we need to go into Y and get all of that scheduled at the same time. So it was ongoing and felt like a big marathon, an Ironman, really, for myself, navigating it at the time.
Thank you.
Yeah.
So you had been married for a year. You had a
Yes.
new cancer diagnosis, And then, and I've actually read in the literature that the only thing that approximates the mental distress of a new cancer diagnosis is having to deal with fertility at the same time. Infertility provokes as much anxiety as a cancer diagnosis. Of course it does. It's existential for people. So you had both of those things compounded, and then on top of it, you had to advocate for yourself. Let's go to the next slide here. Sorry, were you going to say something, Lisa?
No, I was just
I
going to
just
say
had to like
yes. Not
amplify
on my
that.
bingo card for the pandemic
Yeah,
for sure, but yes, 100%.
it's just so remarkable that I had to amplify that point. Let's go to the next slide. And one of the things that we did in the study design is we wanted to distinguish between information accuracy and information confidence, because the worst thing is confidently held misinformation. So um, the overwhelming majority, so most employees or most employers see this as an important issue. You do too. That's why hundreds of people registered for this webinar. Most, when we fielded the study, were confident that their employees had access to the services that they need. And maybe what that looked like is what Lisa had, right? Like there were fertility services and there were cancer services, but doesn't necessarily mean that they're put together. So we can get into that. And it actually turns out that the minority of employers and leaders that we spoke with actually verified that that was the case. They just thought it was the case. So we'll go a little bit deeper into that. But Lisa, I wanted to ask you, when you were going through this, did you feel like your employer had it covered? I should have asked, was Maven your employer at the time? But either way, whether we have egg on our face or not, what did you actually encounter from your employer? How did they support you, if at all?
Yeah, so this was prior to Maven. It's actually a big part of the reason why I'm at Maven today. I will share covered is I think quite literally the right word. I had health plan coverage for cancer treatment. I had good medical plan coverage, and I had a financial benefit that covered fertility to a point. But the navigation of all of those things, the understanding exactly what was covered, what was not, and the coordination of that care, again, was all upon me as the employee. I don't I don't know that at the time this just wasn't a topic that was really talked about and the crossover event, so to speak, of cancer and fertility. Again, I didn't have any peers going through it who I could lean on to learn more, but peers aren't the solution, right? Peers should be the benefit, the add-on, that community, but there needs to be additional support that helps navigate that individual from start to finish. And so what I felt was lacking was that coordination and continuity of care between these two very stressful situations, all while having a very high visibility, demanding job that I wanted to perform at and return to successfully. But knowing that this treatment, navigating all of these things was really a full-time job in and of itself.
Yeah, I can only imagine. Okay, so let's get a little bit more deep into this. And Ashley, maybe we'll have you take us through this one.
Sure. And just as touched on later, it's important to say again, fertility preservation decisions often happen in that narrow window between diagnosis and treatment. And during that time, employees need to quickly understand if treatment will affect their fertility or could affect their fertility, evaluate their preservation options, coordinate across providers, clarify coverage, and then act. And even short delays can compress or eliminate that opportunity to preserve fertility before treatment begins. So, this is one of the few moments where benefit design, clinical management, and clinical timing intersect so directly. So, most employers recognize the importance of speed in theory, but many still lack the infrastructure required to support it in practice. There needs to be a solution that provides, again, rapid access to oncology-informed clinical intervention, coordinate the next steps, provide clear pathways between cancer care and fertility preservation, and systems capable of functioning with real treatment timelines. So this is why oncofertility cannot be addressed effectively through isolated point solutions alone. The more fragmented the experience becomes, the harder it is for employees to act quickly and confidently during probably one of the most vulnerable and stressful moments of their lives. In these moments, employees are not simply looking for administrative support. They need timely, oncology-informed clinical involvement capable of influencing treatment and fertility discussions and decisions before their options narrow.
Yeah, that's really well said. On the Maven side, I spent a lot of time learning about and thinking about the infrastructure necessary for this. And just to be very concrete, um, in the Maven network, it's really important for us to ensure that oncofertility expertise is present on the ground. And when I've dug into what that means, it's having the systems, as you mentioned, Ashley, to make sure that care can be appropriately expedient, in addition to having the context and what the treatment could mean for folks. Um, in the study that we fielded, 1 in 3 employers did not have any kind of process to support on their side when an employee raised their hand and had this kind of need. And 34% actually had just a big hole. They had a gap when it came to the benefit itself. And so in the absence of process, what happens? Like either, you have Lisa, who I've known for many years now and would expect no less from in terms of self-advocacy and is dispositionally ready to go do what she needs to do, but most end up defaulting to what the health plan might do and coordinate. In practice, though, that, as you can imagine, leaves people in the lurch, being handed off from entity to entity with no clear owner, and a lot of people end up falling through the cracks. And literally a day, one day, can make the difference between someone having the potential to build a family and not. Um, I don't know, Lisa, is there anything else you want to say about that aspect of it? I mean, I come back to this idea that you've mentioned a few times is that, just having the cancer part addressed doesn't mean that you don't have other needs that still require care and support.
Yeah, I think it's twofold. When the financial coverage, be that through medical or helping somebody to start or expand their family with a dollar amount, right, from an employer-sponsored benefit, it's the right start. What I found is as I've shared, I'm one of the lucky ones. I had an amazing team. I had a team that made me feel empowered again once I got to the point of diagnosis. But Neil, as you just shared, I'm quite bullish on figuring things out and cutting through the muck for myself and anyone in my circle. It can be really hard to do that when you don't have the jargon, the training, or just dog with a bone mentality when you're exhausted. These treatments are exhausting, anything that you're going through in cancer or fertility. And so I share this because we as patients need more. Something that particularly stands out to me now as a 5-year Maven member myself is our care is specific to the individual. And so when I was able to navigate family building after years and years of scans, continued hormone treatment, everything under the sun, I was able to share, this is my diagnosis, this is my background. I can't do all of the things that somebody might be able to do. And I need to have a provider with the empathy who understands that it's not one size fits all for that support. And so having that round the clock care through Maven, through our partnership with Color, is deeply meaningful to an individual who needs to round out that coverage and be supported not only through dollars available, but have the care they deserve throughout every season, including sleep training, which, oof, it's been fun the past few months.
Yeah. Okay, so let's close out some of the data that we have here. And Ashley, back to you.
Sure. I do think that, well, based on the data, employers are aware they need a different model, but there's a difference in awareness and action. And I think action is lagging. So 96% of benefit leaders believe rising cancer rates in young adults require a different benefits approach. 74% of survey respondents are interested in learning about an integrated benefit that addresses both cancer detection and fertility preservation. But again, like I said, recognition does not always translate into immediate action. Only 44% reported actively evaluating changes to their benefits within the next 12 months to address these needs. And this gap between awareness and implementation reveals an important reality. Employers are not all responding to this shift in the same way. Granted, some organizations are responding to employee demand and real workforce incidents. Others are still trying to build internal business cases around ROI, cost reduction, and practical implementations. So I think this gap is exactly what the Maven and Color partnership is designed to close.
That's well said. Um, yeah. So, I mean, we've made the case, I think, here that there's a pretty clear gap and an opportunity to bring these two pieces together. Um, I think what I want to do actually is get ahead of some of the questions I already see in the Q&A. So it's a little bit out of order, but it's like right to the point of why this coordination matters and something that both Ashley and Lisa said. I'm going to read this question from Julia Stahl from the Dana-Farber Cancer Institute. This is someone who's a research fellow focused on oncofertility. So this is a very, very informed question. Um, and we're being asked what it looks like in practice to bring, I think, the payment side of fertility preservation together with the care coordination. And I think often care coordination is the abstraction, but I think in this case we've made it very clear. Like you can only imagine what Lisa's experience was and how it could have been made better with a more coordinated and integrated approach. The payment side actually is what's a little more abstract here. So I want to address this. Um, you basically have three levers to change care. One is care management, that's the coordination stuff. The other is like network design. And so that's part of what we were talking about, making sure people are being navigated to the right places to receive care, places that know how to treat cancer patients and have expedited pathways for oncofertility. But the third is benefit design. And I think that's the part that's the least understood. But a big part of our approach in this partnership is making sure we're designing benefits that make sense for this population. And so, for example, something that I've encountered over and over again in the absence of this kind of solution is that cancer survivors or people who are about to get treatment for cancer will be told that they can't have their fertility benefit because they're not infertile yet, even though they know that they're going to be rendered infertile by the treatment. And that's absurd, right? And that's something that can be addressed in a very straightforward way with better benefit design. So I just wanted to sort of get ahead of that and sort of explain why it's so important to have the care part and the payment part be part of the same solution. Okay, let's go ahead to the next slide. And I might have you close this out with some of the data. Let's go maybe one more slide forward. Um, Rebecca, do you want to talk a little bit about just what this means from a finance and cost perspective? Ashley, maybe over to you.
Um, from a financing cost perspective, I can tell you that cancer is now the number one driver of all healthcare costs. And in addition to oncofertility, that is significant. So I think knowledge up front, it can really inform action going forward. I think we're quite honestly, we're kind of figuring it out as we go along, but it is a huge issue. It needs one to be addressed. But as a first step, I think this partnership addresses that.
Yeah, I think you're right. I mean, let's be honest. If you have a few thousand employees, um, the number of your people who will have this really wrenching human need will be in the dozens, right? And so there's the human dimension of it. And then the cost part of it almost feels crass. That being said, in a system where there's no coordination or there's inadequate coordination and integration in place, you can imagine that both you and your employee who you're trying to protect with the right coverage is probably not getting a great value, in addition to probably not getting a great outcome. So I couldn't agree more, Ashley. Um, we covered a lot of data today. I want to end where we started on the human side of this. And so, Lisa, I want to just give you the mic to talk about what it would have meant to have the kind of support that we're talking about here when you were going through this diagnosis?
Sure. And I say this wholeheartedly, this type of support would have been life-changing. It would have been amazing to know that we weren't alone in this sense. Not only were we physically alone in lockdown in a pandemic with cancer, but navigating all of this in real time, as all of us have shared, with really high stakes decisions and a lot of underlying anxiety was really hard. And I think too, I worked for a top 15 employer at the time, amazing benefits and all that I could have, in theory, asked for on paper. But going through it, I think I realized very quickly how the onus shouldn't be on the individual and the patient who's already going through so much. And so I think not only is this partnership deeply meaningful to me as a human, but as I shared earlier, my team works with total rewards leaders worldwide on bringing inclusive, dynamic, and clinically driven benefits to their teams. And having this pairing of two very challenging diagnoses, navigations happening at the same time is going to be a game changer for so many people. And I'll share personally that like the journey's never over. There are so many scans, and now I have a different set of anxiety going through a maintenance scan, so to speak, with a baby. Different level of what I'm going through now, even if it's the exact same scan as it was 2 years ago. And so the need for this care, the integration, the support doesn't stop when your last radiation treatment occurs or you get the call that you've achieved a pregnancy. It really is lifelong and necessary for everyone who's going through this.
Well, thank you, Lisa. We do have a couple of minutes. If folks do have questions, feel free to drop them into the Q&A. One of the questions that I see here right away as folks are thinking about this is a brass tacks implementation question. And so I just want to speak to that really quickly. Implementation of this solution, there's an amendment to the existing MSA with either Color or Maven, so there's no separate agreements required. There's flexible billing through TPA, but Brian, you had a question. There is also a direct route to contracting. And the idea is have a coordinated member experience and warm handoffs from day one so that the member doesn't perceive that there's two different programs, that there's actually just one experience. Okay, one more question here. Um, is this only for women? Lisa, you talked about your partner a little bit. Ashley, I might throw this to you. Is this only for women?
No, absolutely
Okay.
not. Fertility preservation is for men and women. Fertility preservation is so much more complicated for women. And so that's why we're focusing on this. But fertility preservation is incredibly important for men. Um, it needs to be discussed again at the time of diagnosis. Men can decide if they want to, they can freeze sperm for the future. And then the costs need to be discussed as well. So absolutely, it's for both men and women, partnered, single, anybody who is in the probably anybody under 45 years of age, whether they are interested in having a family at that time or not, it needs to be discussed because many times people change their mind.
Hmm. Say more about that, Ashley.
Regarding how people change their mind.
Yeah.
So it is not infrequent. I've seen many adolescents and young adults. And when I say young adults, I'm saying, let's say in their 20s, early 20s, mid 20s, and they have no interest in children. Not interested, not at all. I continue to follow them every year. And then something happens. It is not infrequent. All of a sudden, having their own biological child would be really meaningful, important for them. And so I would hate for them not to have the opportunities at that time that they, based on decisions they made when they were 18 or 19 or 20 or 21. So I feel very strongly that fertility preservation needs to be discussed in all individuals under 45 years of age. And continue to bring up even after treatment, because sometimes treatment can cause, let's say, premature ovarian insufficiency or early menopause. And so maybe there is a time for fertility preservation after treatment. So it is an ongoing conversation in this age group.
Yeah, that makes a lot of sense and actually speaks to the mechanics of what we're trying to solve for here, which is, are people universally uh, asked about preservation, or is that even brought up universally? It's pretty inconsistent, it seems like. And then if it is, it seems like our experience at Maven is most people want the option. Some people know that they want kids, some people aren't sure, some people don't but change their mind, but most people want to have the option available to them. Is that your experience as well, Ashley?
Well, I think most people, it depends on the age. I would say
Mm.
most 18-year-olds have no interest.
Yeah,
But
fair enough.
but but now it is an ASCO recommendation that fertility is discussed within 24 hours of a diagnosis and continues to be discussed going forward because people do change their minds.
Yeah, fair enough. Um, Well, I think we're just about at time. We've covered a lot of ground today. Ashley, thank you so much for lending all of your expertise and for leading a program in survivorship for so long. I will say, this partnership between Color and Maven is the first of its kind. And normally, Color and Maven like to think of ourselves as innovative companies. We like to be first. But it's actually a lament that this is a first of its kind program because we need programs like this for all the reasons we've talked about. And Lisa, thank you so much for sharing your personal experience, which is a version of what so many young people are going through needlessly. And of course, thank you to everybody for joining. Have a great Monday.
Thank you.
Thank you all.